Hey guys, my name is Mandy Torres, and this is my presentation on surgical site infections. First, I'm gonna just start off by talking about what a surgical site infection is. Our skin serves as a natural defense against infections, and unfortunately, despite implementing numerous precautions and protocols, any surgical procedure that disrupts the skin can result in an infection. These infections are referred to as surgical site infections since they arise obviously at the location of the surgery. Did you guys know that post-operative surgical infections occur about 1 to 3% of surgical patients, and they can lead to longer hospital stays and increased healthcare costs? Surgical site infections contribute significantly to postoperative morbidity and mortality rates, and current data shows that they're responsible for over 2 million nosocomial infections in the United States. Um, I chose this topic because I work in the operating room, so surgical site infections are obviously a big thing. And I found this information up here pretty cool too, because it just talks about the top 5 risks for surgical site infection surgeries. 1, colon surgery; 2, vascular; 3, cholecystectomies; 4, organ; and 5, tumor related. And I actually do quite a bit of colon and cholecystectomies, probably almost daily in my practice. So that's pretty cool to know the statistical rates on that. This next slide is just showing the classifications of surgical site infections, which I had this picture attached to it, so you can see like what they look like in cartoon and in real form. Superficial incisional SSIs. These infections only affect the skin and the subcutaneous tissue of the incision, and typically seen within about 30 days of a surgery. And you can see here it's the skin and subcutaneous tissue. And then number 2, the deep incisional SSIs. These involve the fascia and the muscle layers, also typically seen within 30 days postoperatively. And then we have the heavy duty guys here, the organ or space SSIs. This type of infection can be in any area of the body other than the skin, muscle, and surrounding tissue that was involved in the surgery. So this is like body organs or space between organs. Usually 30 days postoperatively, you'll see these sort of infections. And this is interesting I put in here because this is just data surrounding um, SSIs. And this here shows, if you see, it's like superficial surgical infections, deep organ. This is how many days post-op, and this is the amount of incidents that it's estimated to get these infections, right? And if you can see, obviously the superficial ones, they have a higher rate because it's on the outside of the skin. But we have these deep organ ones that are just as prominent, but not as much. And we tend to would see these things, looks like pretty quickly, probably within, 1 to 7 days of the post-op surgery. So, with these SSIs, the key here is prevention, right? Um, and prevention measures, they tend to have like a holistic strategy covering pre-op, intra-op, and post-op phases of surgery, right? Um, So during pre-op measures, we can do things like blood glucose control. We can remove hair from certain parts of the body that we're going to be operating on because, having facial hair at a surgical site really greatly increases the risk for infections. Cleaning techniques, and I wrote this in here specific to total joint replacements slash education because in my practice, we do a lot of total joints, so we really focus on, like certain soaps, chloroprops, and things like that, intraoperatively, but pre-op too. And then obviously, antibiotic prophylactic is pretty big. And then if we're talking intra-op, we have aseptic techniques where we want to try to keep our sterile field from not being contaminated. Um, and wound irrigation, because if we're in there cleaning out a wound or something and it has bacteria, we want to get all that out of there, not keep it in there. Maintaining the correct body temperature is also key for to prevent infections. And again, blood glucose levels. And if you see it's up there as well, it's just really a huge part of surgery in general. from beginning to end. And then some post-operative measures. Obviously, we're going to continue the antibiotic therapy, nutritional support, which is really big, especially for wound healing in general. We want to give proper protein and things along that line to really help speed up the process of healing and reduce the risk for those infections from open spots in the skin and things. And then obviously oxygen therapy helps along with those healing processes. So that is my presentation. I hope you guys enjoyed.